Good afternoon, everyone. Thank you so much for joining us today. And welcome to the Cheese X Community Health Science X O'Brien Institute Anchor Seminar. To kick things off, we will start with a land acknowledgement.
The University of Calgary, located in the heart of Southern Alberta, both acknowledges and pays tribute to the traditional territories of peoples of Treaty 7, which include the Black Confederacy, comprised of the Siksika, the Piikani, the Kainai First Nations, the Tsuut'ina First Nations, and the Stoney Nakoda, including the Chiniki, Bearspaw, and Goodstoney First Nations. City of Calgary is also home to the Métis Nation of Alberta, Nosville Métis District 5, and Elbow Métis District 6.
Okay, so wondering what we're doing here today? We are the co-chairs of the Community Health Science Student Executive Team, more lovingly known as CHEESE. So my name is Miriam Arwa. I'm a master's student in the Population and Public Health stream.
And my name is Ariva. I am a master's student in the Medical Education stream for CHS.
And we are the co-chairs for the 2025-2026 team. So we were invited, specifically CHEESE was invited to plan and host an anchor seminar this year, just to give students an opportunity to learn the ins and outs of planning events such as these. And so we're incredibly excited to bring you today the title of today's presentation, Evolving Realities in Health Ethics.
So today's seminar is going to be talking about emerging technologies, data practices, community-driven approaches, and transformative landscapes of ethical decision-making, specifically in healthcare research. And we're going to discuss topics such as informed consent strategies to prevent biases, misuse of data, integration of lived experiences in research, and the importance of Indigenous and sovereignty, and participatory research frameworks like SPORE and CPPR.
So whether you're a researcher, student, academic staff member, or if you're just really interested in evolving ethical practices, like myself, this seminar will offer you a space to reflect on justice, reciprocity, and the real-world implications of our work.
And we have some amazing panelists today with us. We have Dr. Turin Chowdhury, who's a professor in family medicine and community health sciences. His primary research interests are challenges in access to care and unmet needs faced by socially vulnerable populations of society, including the new immigrants, refugees, and visible minorities.
We have Dr. Monica Caicedo Roa, a postdoc with Dr. Erin Godarzi, an epidemiologist with the Evict Radon National Study. Her research project is focused on understanding radiation-related lung cancer risk among people living with disabilities and their families in Canada.
And our final panelist, Robyn Giffen, here is finishing a PhD in education and is the ethics and process specialist with Indigenous Research Support Team, IRST, and provides specialized support for Indigenous research ethics in human participation research. She conducts consultations with research and research ethic board committee members and provides feedback on Indigenous research ethics applications.
Okay, so just to kick things off, we have a question from us. And this, we can each take turns kind of answering this question. And it is, what has been your greatest challenge navigating health ethics? So maybe we can start with, anyone who's interested. Passionate.
Okay, so when they gave me the questions, so it was about, what is the main point of the experience that challenged my understanding of ethics. So there is a thing that happened in 2012, probably that shaped my understanding. So I was a postdoc at that time. I'm postdoc moving towards the faculty position. And we wrote a paper about lifetime risk of diabetes among First Nations in Canada. So, by the way, whatever I am now, at that time I was a number cruncher, like a lot of you. My cubicle was my world, my laptop was my, the universe, whatever it is. So we crunched the numbers of 3.1 million Albertans data which we got through Alberta Health Service. My postdoc, Brenda Amelgarn, at that time in our team, Fiona was there, Paul was there. So we crunched those numbers and we reported that, if we follow 20 years age First Nations kid, a cohort of 100, and if we follow them till the age of 84, Canada's life expectancy, 80% of them will develop diabetes. So that's a huge burden, but it's not a new information. So we wrote it up as you guys, we submitted it to CMAJ, and then, finger crossed, because that's going to a CMAJ would have been a big deal at that time for me. Still it is. So after 3 months, the reviewers came back, and again, just a thing, all of us have read papers or you are writing papers. We have a discussion section where we try to defend the results we saw, right? Like it's not a fluke, it really makes sense, that type of thing. So when we saw this high burden of diabetes among First Nations, in the discussion section, I tried to defend it. Yes, what we saw is not unreal because the sedentary lifestyle, because of the food habits, because of those other things that we penned and all referenced and properly done, we submitted it. The sort of a reviewer came back, the associate editor made a point, like, Dr. Chowdhury, it looks like you are blaming the First Nations for the happening of this diabetes burden, because the way I wrote it. And can you take a sort of a view of social epidemiology and look back and really think what's happening there? And again, so that was a eye-opening scenario, and they said that they liked the paper. So at that time, I was ready to do anything for my paper to go to the CMAJ, even selling my soul to Satan. And doing a revision is a simple thing. So, but the thing is, like, I was studying, reading the historical context, the epidemiology, and all other things, the social determinants. So I ended up asking for 6 or 7 extension. And then we finally wrote historical mistreatment, historical disadvantaging the communities that led to loss of trust on the system and others. And then that led to those choices of making of, that led to diabetes epidemic that we call it. Now, my research was totally ethics approved. Ethics board approved it, our own ethics board, and we did everything right. But on the other hand, still, I felt I was in the verge of falling into the trap to contribute to a disservice to the community. So at that time, my thinking of ethics and ethical challenges changed. So at that time, I started to think research ethics versus ethical research. Research ethics follows, in our system, don't do harm. Make sure that, they put things in place, or we come up with informed consents and everything to make sure that we don't do harm to the communities that we are working with or working about. But ethical research takes the horizon much more broader. Like, research ethics doesn't mean I am doing a good job in research. So I think that was the point, that was the experience that shaped my understanding about ethical practice. How should it look like? What are the components of it, and moving forward? Thanks.
That's a impactful experience. Are either of you able to have that? Yeah, so
Not quite so significant, but as you guys said, so I support folks who are submitting ethics applications that involve Indigenous research, and sometimes I review ethics applications, or I support reviewers who are looking at applications. And one of the biggest challenges that we see in health ethics applications is that folks don't know for sure who's going to come forward in a study. And so they don't know if their research is going to be Indigenous or not. There's 5 criteria that we use to talk about whether research is Indigenous. But one of them is that, or the 2 that are sort of relevant, is that you're either going to recruit folks who are fall under an Indigenous demographic, which in Canada is First Nations, Métis, or Inuit, or that you're going to make conclusions based on folks' demographics. And so in health research, you don't always know who's going to agree to participate in your study, but often there's some sort of question that asks about demographic data. Are you Caucasian, Indigenous, et cetera, et cetera? And as soon as you put that question in, there's the opportunity to analyze your results using that data. And researchers will say, but it's not Indigenous because I might not do that. And we say, okay, then don't collect that data. And they say, but I want to, because what if it is? So this gets us this sort of chicken and the egg of which do I do first? And so sometimes researchers, the the requirement of if you are doing Indigenous research is that you have to do community engagement. So you have to talk to folks from the relevant community about the research, about the design, about how you're going to analyze it, about who's going to own the data. And before people have filled in your survey, agreed to participate, you don't know who that community is going to be. And so people often say, I'm going to wait and I'll do that later. If a bunch of First Nations folks participate, then we'll do community engagement. But community engagement means that you're supposed to have input on the design of your research project. And so if you've already designed your whole research project and then someone, enough people say, I'm Indigenous, and you stop, are you really redesigning, or are you just saying, okay, great, here's what we've already done. This is cool, right? You're on board, yeah? So we have a real challenge with encouraging folks to, if you think that enough Indigenous folks are going to participate, that you may be able to analyze your results in a way that references that you should do the community engagement first, rather than having to stop your research and do it later. But so yeah, it's a challenge that we see.
Well, I just want to give you maybe a little of context why I'm here. And I'm from Colombia. Originally, I did my PhD in Brazil. When I lived for 8 years, and now I'm a postdoc here for 2.5 years. So I'm very excited to share some of my experience here. And the idea of being here is that I want to share some of my experience working with different populations. So when I was in Brazil, I worked on violence against women, particularly in femicide. And I was a part of a group that studied death because of external causes. It means suicides, homicides, and all the violent events that cause death. So the purpose of our research was understand better the risk factors associated to these events in the population. So I was living in a city, in a little city that is close to São Paulo state. And in this city, basically we were doing a population study. So we have the cases that was people who suffer. There are families who suffer from a death, and there are controlled individuals that are people normally in the city that walk in the street. So the idea with these two populations was identify risk factors, but to make a deep interview about social things or factors that in fact contribute to the death. So working in this environment is like a very research experience, because you have all the possibility to ask about things and do this one-by-one work. So working with families that are in pain, because the loop was 15 days. It means we have a report. They say, we have a femicide case, for example. Then we wait for 15 days, and then we go to the house of this family for asking things about these women. You know that in this context, this kind of research is very hard for people who are interviewed, for families, for researchers. And one of the things that recommend the ethics board for us was having a support group, because of course you are working in a very painful moment of the life of these people. We saw several reactions. Of course, there was families that was very not happy, but they are recognized that his parent or was having an experience that can help other people in the city. And others was very angry because don't want to respond any question about the fact, And when we were designing this kind of research, we have to be very careful about the questions we are going to ask people and the way as this question is understood. So it was one of my experience, one of the most important experience that I had as a researcher. Then in Brazil too, I had the possibility to join one a strange group for women victims of intimate partner violence. So it was a very nice experience too, because these women have the opportunity to talk about their experience, the violence they have suffered, the context, life, decisions, and try to rethink about these patterns and how to go out of this situation of violence. So it was a nice experience too. Of course, it was a vulnerable population. So when you do research with this vulnerable population, you need to be very careful about the purpose of your research and that this research really have like an impact in the community. Because you are causing suffer or you are, causing some discomfort, asking questions, asking intimate questions, or just telling or just asking about the story. And here in Calgary, we have I'm working with a very different population, that is people with disabilities. And as you probably know, this is a very diverse community. So we have like people who have more than one disability or any kind of disability, blind people, deaf people, or people who, have other disabilities. And it is interesting to see how this community is interested in being part of research. So even people with intellectual disability that are very happy to participate in this kind of research. However, as a researcher, sometimes we have like some beliefs that prevent us to really go to this population and ask, think, and understand them as subjects. So this is a thing that we need to work on. And it is something that you don't realize until you are really in the research. Because of course, all of we are like very professionals and we know about ethics. But just when you are interviewing people or working with these people, is that you really realize, oh no, I'm misunderstanding, or I'm following like a capability thing, you know? So yeah, this is like my my 3 moments or 3 research that was really impactful in ethics terms.
Thank you so much for
That's some unique challenges and like diverse ways of navigating all through those for ethical research or the ethics of research, as Dr. Chowdhury put it. At this moment, we'd like to open up the questions to the audience. If we have any here today for the panelists. Any online? Not yet.
Yeah, so thank you all for sharing your stories. One thing that kind of struck me is from everything that you all said is the importance of engaging the people that you're doing research with, and not thinking about doing research on people, but doing research with people. And so I wonder if you could maybe just reflect on any strategies that you have employed in your own work that allow you to form those authentic relationships with the groups that you're working with.
You want to speak to them?
Yeah, sure. So in Indigenous research specifically, the sort of guidelines for community engagement are quite explicit and outlined in TCPS 2 Chapter 9. And I would say the most important thing is just that you take the time to do it. We sometimes use an analogy that community engagement is like dating. Right, that you don't know everything you need to know about someone on the first date, right? You have to go on a couple of dates. That probably if you're looking for someone to date, you look within your own network first, like who are your friends, who are people that you know, and then do, if there's no one in that group that seems suitable, then like, do those folks have anyone who they could introduce you to before we get to the sort of blind dating stage of like an app or something. So the same thing goes for community engagement. Is if you are, wanting to do research in a particular community, do you have any of your own connections into that community? If you don't, do any of the folks that you already have connections to have connections in that community so that they can provide an introduction, that they can sort of vet you and vouch for you? And if not, can we look online to see who is the right person to connect with on this, in this community? So is that through a First Nations website, Chief and Council? Is that through an organization that serves the community that you're looking at? And I'll say for graduate students, which I know there are many in this room, one of the challenges is that we have short timelines because our funding is not indefinite, and we have department deadlines that we need to meet, or expectations to uphold. And so community engagement should start early to afford yourself the time that you need. And also it may slow you down, which is like not something any of us want to hear. 7th-year PhD student here. But it's just a necessity of doing good work, is that you have to spend enough time in the community that folks trust you, that you know that folks are engaging with you authentically. And if that means that you have to push back against a departmental policy that says you will begin conducting data on this date, maybe you have to do that, and probably your research will be better for it. But it's definitely a complexity of doing engagement well.
Go ahead.
People with disabilities have like a saying that is anything about us without us. And the idea of this is basically recognize the participation in the design of the research. Because yeah, it is very easy for people like write a proposal or just analyzing the data and imagine a reality. But when you are working with these people, you really understand that they have special things. For example, a basic one is that when you are like doing interviews for focus groups, it's important to have some time for resting, because they have different times. So for example, if you are this kind of person that wants like a perfect response, you probably need to deal with, because you need to wait to the speed to the person who is telling you a story. So for example, these kind of spaces are like very important, and it's why, well, I completely agree that we need to spend a lot of time with this community or understand this community, and if possible, have like a first approach before asking for consents or for participation or for explaining your research. Because creating this kind of relations, of friendship relation, can help you to really have a real participation about the topics you are asking about. For example, in radon, I don't know if you know a lot of radon, but it is a gas that is present in our houses and is a risk factor for developing lung cancer. So basically, our research is about understanding more how much or how long people with disabilities spend in their houses, and if they have a different risk from people who doesn't have any disability. So in this case, you need to talk about a risk factor that could be present or not. So you are putting an extra thing for people to worry about. So this is one of the things that we need to think better and try to find different ways to explain this for people, for example, with disabilities. Is this people a person with a cognitive disability, so need a design or something for help her or him to understand better? So I think that having like an advice or a person with disability in your group help a lot to better manage these kind of things. But of course, I think that is a process. For example, in disability and inclusion here at the university, instead we are doing a great job. We need to keep working on that and including more this population and people with different disabilities. Because, for example, cognitive disabilities, it's like a very specific group that is very hard to work on, because you need not just the person with a disability, but the caregiver, you know, for creating an atmosphere that really allows you to do the research. So, yeah, it's trying to find strategies for inclusion and, yeah, be aware of limitations.
So for me, the strategy is very simple. Just be there. Because like being there, they're seeing you, magic happens. It's not my doing, just being there. Because when I started doing research in the community, especially in the grassroots communities of visual minority communities, there was a reluctance, hesitancy towards the work we wanted to do. And the only way I could have overcome that is just be there. They see me day in weekends or in their events. They start, the how do you call it? The strangeness of my appearance started fading out. That's number one. Number two is, after being there, I think it goes to that dating side a little bit, that being there, you start tapping on the shoulders that had made an eye contact with the hope that, okay, they might listen to you. And out of this 10 tapping on the shoulder, one or two starts talking. And then you go and branch in with that. So being there solves all the problem. Now, one more thing I just want to add. I don't put any responsibility on the students, you guys, to do the community engagement for research, because I believe that the program of research you are plugging in, they should have done all those things and they should be continuing these things. You just come in, continue with those things and graduate and hopefully go out, but be champions of the causes. So if you guys are in a scenario, maybe you guys are in a scenario where you belong to that community and you're passionate so much, you want to start from zero, most welcome. But I believe like starting from zero for the grad students is not a very conducive scenario. It should be me, my program of research, our coming schools, our OIPH, our CSMs, CHS have that thing already going so that you come and get a rich experience and move forward with the learning. Okay.
I think that's incredibly powerful, especially as you were saying in regards to deadlines and, other concerns that students have. That's incredible feedback.
Could I just add one thing to that, which is, I very much agree, and I think depending on the type of research that you're doing, it's easier to, like, if you're joining an existing project. One thing that we do sometimes see in research applications in the Indigenous peoples section, so if you've never filled this in before, there's a question that basically asks if you're doing Indigenous research. If you say yes, it brings up a new section. And in that section, it asks about relationships that you have with the community or the engagement that you've done. And sometimes people say, my research supervisor has a relationship with the community. And then they move on to the next question. And that is it's simply insufficient to answer that question. It's absolutely great if your supervisor has built that relationship and done that engagement and you're joining an existing project, but you have to say a little bit more about like what your supervisor has done to build that relationship and how they're bringing you in, right? So my supervisor has worked with this community for 10 years and have done this engagement. This is the third project. And my supervisor has introduced me to the community and I've been at this event and I've been here and like, this is what I'm going to do. So absolutely great and awesome if you have a supervisor who's done that work and who can bring you in. But just make sure that you expand and you explain how you have been brought into the project, not just my researcher or my supervisor already did the community engagement. I'm good. You're not good.
I have a question for the audience, like especially the student audience. How many of you are doing your master's or PhD work on already existing data set? Means you guys already have the data set in your computer. Only one. Wow, CHS has changed. Because if it was, 5-7 years back when I started, I think 90% would have put their hand down. We already have that, Alberta Health Service data or the clinical data or DIMAT data or StatsCan data. So it's good to see like only one of you have already data waiting in your laptop to analyze and graduate. But the others, probably you are collecting data. Awesome. We have really changed towards good. Now, how many of you of the data collecting have interacted with the subgroup of people, not maybe the exact data we're giving, but that group, like for example, if I'm doing a research with the religious leaders of how to improve health literacy. So I need to go and talk to them, and they need to be part of my discussion, or they need to be my sounding board. How many of you have that already in place, the community level sounding board? Okay, so the others, please create that sounding board, make your supervisors responsible if they are the place, their connectivity is there, getting the sounding board. Because the mistake I was about to make, I didn't have a proper sounding board and I didn't even think about it. So community engagement is so important for even data crunching people as well. So that's the point, because normally when we say community engagement, oh, they are doing qualitative studies. But the patient chart review, the secondary data collection from Netcare or others, or you go to the patients and then collect information from them, still representative people of them bounce the ideas you have, bounce the things they are moving forward. You have a discussion and things, your horizon will open up.
Very good points. It's a good temperature room check there.
We have a question back there. Do you have a question?
Yeah, great discussion so far. I'm curious about, I've always thought about ethics, health ethics as reflections of our societal values, how inclusion, you guys have listed how, ways to incorporate sort of changes in our societal values. So what about questions that reflect individual choice? So two examples come to mind. Critically ill patients who, getting life-sustaining treatment may result in lifelong disability or poorer outcomes afterwards. Or patients, for example, with dementia that in neither situation have expressed the goals of care or, reflection of what they want. So when that individual choice when society doesn't have a good image of what the average person should receive, and the individual may want something different. Like, has research ethics or research into ethics, how is it approached with those methods?
To me, we failed them. We failed them in terms of research ethics piece. But on the other hand, I'm pretty sure, the research ethics piece, we are resource strapped. They have to go so many hundreds of applications and everything. I don't want the onus be on them to deal with that component. That onus is on us researchers, how we interact. And I will use the word, ethical research. So maybe in my head, to wrap my head around, research ethics is my approval, informed consent, do no harm, make sure everything is, according to thing, but ethical research, where my heart and soul comes in. So that's the part when you will be interacting with them. And you as a researcher who is very much defined and motivated by the worldview and other components of that ethical research, even who you are yourself, I think it's the social accountability we have to put us to that level and then understand the context and deal with that. I will not put the onus on the research ethics side, that administrative, making sure no harm done side on that aspect. Again, this is my personal way of approaching that.
I should say, so it's, I would say it can be riskier to do some of that research, particularly on the health side. So, I was just looking it up to remind myself, but, has anyone ever heard of the Ogden case at SFU? So this is a really interesting ethics controversy, where a master's student, Robert Ogden, in the early 1990s, got approved and got ethics approval from Simon Fraser University to do research, do interviews with folks who had assisted with, like medical assisted death, before that was legal in Canada. And in 1994, the student who had graduated and published his thesis was held in contempt of court for not handing over his interview list of the folks who had participated. And SFU refused to legally support the student. So that was a really interesting example of where sort of officially, right, the societal stance was that like MAID programs were not acceptable. But obviously it was happening and people knew that it was happening. And so, first of all, I think, yes, research has changed substantially because I do not think that a master's student would be approved to do that kind of research now. But it was a really interesting case of like fascinating research, super significant in changing views around that. As it turned out, the judge upheld that the student was not required to hand it over, that the sort of protections offered by the Research Ethics Board should be held. But SFU never, they never actually backed the student. So I think there's complexity in investigating some of those topics and finding ways. And I think according to experts, that's the only time that like a researcher has been brought before an ethics board for that kind of thing. But I think there's complexity, certainly not always to that extent, but it's really interesting, again, to think about, right, the research ethics versus ethical research. And so research ethics, the board said, we stamp this, we agree, right? The student wasn't doing anything illegal. And ethically, that was meaningful and significant research. But the researcher was really hung out to dry. So it's a very interesting case. I encourage you, if you just look up SFU ethics controversy, you will find it. So interesting, but complicated.
I think that's an incredibly insightful question. How far that ethics branches out to individuals, researchers.
Can't wait to read the rest of that.
Yes.
Do we have any other questions from the audience? I think Zach, did you have a question?
Oh, yes, I have a question. Sorry, also, it would be amazing if you could speak up just a bit, because it is quite difficult to hear in the back, including some of the panelists. That'd be amazing. My question was about navigating with the research and ethics board. If maybe you're working with communities or other academics who are saying, no, this is how we should proceed. This is the right set of steps that we have been, suggesting that we follow. But then maybe we get pushback from the meeting. Like we're going back to our RED colleagues. But I'm just wondering, like, have you had that experience having navigated?
That's a great question. Thank you so much.
Who has submitted a research ethics application before? Okay, so the a very brief overview of the research ethics process is that you write an application. If you are a student, your PI, so your supervisor, has to officially submit it. It's sort of like in the medical field where you're working under someone's license. You submit it, there's an admin level review for someone from the ethics and compliance department who checks it over, makes sure everything is complete, sees any obvious issues, send it back, it gets fixed. And then when it comes in, they assess it for risk. And so there's two different ways that an ethics application can be reviewed. There's delegated review, where the risk is deemed to be minimal to the research participants. Minimal risk is research that is causes no more risk than what a participant would encounter in their everyday life. So different populations have different levels of risk. If you're interviewing a firefighter about their work, their level of risk is exponentially higher than someone who works in an office building, running into burning buildings, sitting in an air-conditioned room. If your risk is deemed to be above minimal risk, it goes to full board, which means the full board or quorum of the ethics board gathers and reviews the application together, asks questions, you'll come and present. Delegated review is where the research is reviewed by one, maybe two members of the ethics board. And generally, we look to send it to someone who has expertise in that field. So psychology studies are reviewed by psychologists, law studies are reviewed by lawyers when possible. So generally speaking, I would say that if there is pushback, we'd like to say that it's for good reason because the person has expertise in that area, or that the application is simply not detailed enough to demonstrate that that is best practice, if that path is different than maybe what the reviewer was expecting. But there are definitely like multiple processes. So it's not like you submit it and it's a yes, no, and the end. So if there are questions or feedback that something seems off, the reviewer submits those questions anonymously and they get sent back to the researcher to review. And usually the questions are, yeah, could you tell me more about this? Like, or this seems different than what people normally do. Could you tell me more about why you've made this choice? Could you explain how this relates to the thing that you outlined in your objectives? Or like this seems different in that section. So I would say that if there is significant pushback, that you can request a meeting with the chair to talk about it. But generally speaking, it's just that the application needs more information for the reviewer to understand why that process is correct.
For that question, I'd like to bounce off of that question as well. Say, for example, the ethics board is on board with your plan of community engagement, but then you run into problems with the finance department in how they process acknowledging people for their time. Because as you said, it takes a lot of time on the researcher side, but it also takes a lot of time on the community side. You may not have that amount of time to give freely. How do you navigate working with finance, and can you request a meeting with them to just come up with different solutions on how to get payment to participants faster, and maybe even to navigate the side of things as well?
Yes, so I will say that is currently the bane of our existence on IRST. So for those of you who don't know, especially for Indigenous research, but for other research as well, we offer an offerarium, a thank you for participating and for sharing knowledge. Particularly when we're working with Indigenous communities, there are legal components of it. So research that is conducted for status First Nations on reserve land is tax exempt. Otherwise, anyone who is receiving upwards of $500 has to report that, and that becomes taxable income for the year. And so there is right now a research honoraria task force that has been developed to attempt to negotiate how this all works and what the systems are, and to try to establish policy about who is supposed to be collecting a SIN number. And should we really be making researchers do that? But also, it's sort of sketchy if just some random person from a finance office calls somebody and says, hello, could I please have your SIN number because the University of Calgary has paid you more than $500 this year? So those are, yes, complex issues that we are trying to work out, and they are, right, those are responsibilities that are above the U of C or any other institution because it's federal policy that says that it counts as taxable income. So we are doing our very best to make it better for researchers and for community participants. And we'll hopefully, by the end of this year, that's probably optimistic, by early next year, have a research honoraria toolkit where we can help folks understand what's expected and the best processes for payment and reporting.
Thank you so much for that. Yes, please.
Did I understand that the ethics review would take into account not only the safety of the participants, but also the researcher and the staff, like in the SFQ case? It would have not have passed because of the safety for the. researchers?
So research ethics review is to ensure the safety of participants. It actually doesn't care at all about the safety of researchers, which is problematic. There are some things like an obviously unsafe situation that a researcher would be put in. But there's things that are included in the application. So in the section about like risk, it asks, about psychological distress. And you have to provide information about supports that will be offered to participants. So will there be counselors available? Will there be resource lists? But at no point do we ask, like, what will you, as the researcher who's collecting all of these traumatic stories, do to care for your own health? Because
That's the question that I was wondering, that if the SFU case would have passed anyway. I wonder, and I'm picking up this from a piece of like data privacy, I'm feeling people say that, some that's going over the top. And it's stopping us from doing good research, and they're just being too nitpicky about like data privacy. I'm wondering if you are seeing cases, any of you, where you think the ethics is being over the top careful about what we thought, what we were trying to find with people on board, like this guy that got arrested.
yeah, so that it is problematic, but the research, I don't say this to like negate the value of research ethics, but research ethics is to protect participants and thereby protect the university from lawsuits. And so the university does not anticipate being sued by its own researchers for projects that they chose to take on themselves. And so there absolutely needs to be more like oversight and consideration for for the topics, and not to like academic freedom, not to discourage folks from doing those research, but to have a plan in place for like how you will support yourself as a master's or a PhD student. Like, what is your support system from your supervisor or from sort of anyone else? And there are absolutely resources at the U of C. I would say that. So yes, we need that. And then on the sort of the ethics side, what is complicated, who here has done the TCPS2 tutorial training? Yeah. So what I'm sure that you learned while you were working through that is that the TCPS2, it's a policy, but it's actually guidelines. And so it's up to every individual institution to interpret that and to meet those guidelines. And particularly as an institution that receives funding from the Tri-Council, we don't want to do anything that jeopardizes our ability to receive those millions and millions of dollars. But it also means that there's differences across institutions and research systems. And I think that we are in a point where people are, just trying to ensure that we meet those guidelines the best that we can. And even if it seems sort of over the top, and particularly with things that are new. So the research data management policy is new at the federal level and at the University of Calgary. And so I think there will be a easing once we get more familiar with what is accepted and what becomes the standard and get a little more comfortable with that.
Jimmy, I want to add one thing that you mentioned, like controlling over the top, like, where we think researchers, I could have done a greater job if that was there. Believe me, in that when I go to the history of ethical research or research ethics, all the researchers of their own time were doing all those horrible things in the name of good, in the name of science. So I wish this type of oversight of controlling their issue, because I'm a researcher, I want to do great things. I lose sight of, my great things are making the trouble. So I volunteered to be in the research ethics board, to be the board member, to review things, just to sensitize myself. So I started strongly believing that, it's good to have an issue rather than, having a regret afterwards.
There, I know we're just about to wrap up, and so we're last.
I just want to I just want to add a small well, comment. And it is that, well, for researchers for PIs, it's very important, like taking care of the security, not just the physical security, but the mental security of research of the team. For example, in the research we made about homicides and these kind of things, we have the possibility to have a couple of sessions with a psychologist at the university who help us to deal with these experiences, because in one moment, one of the researchers was like very affected by one of the cases, and we tried to use this space as this compression space for just talking about and understand different realities and well, the context of the research, and it helped us a lot. So it was like a piece of care of mental health. But the other thing was, for example, thinking in physical security, as we was visiting all the places in the city. For example, with homicide cases, there is a risky territories. So being well identified, for example, with the university staff and things, and present you as a healthcare professional, help you to go inside these territories, and the community that is involved, if you can like have some help from the person of the community. For example, we have social workers, and they help us a lot for finding the houses or for finding the families. Because of course, after a traumatic event, family goes to other places. So sometimes it was very hard, like to find someone for doing the interview. And these strategies help us to maintain our physical security and to be in the community.
It's incredibly insightful. Thank you so much.
Take care of yourself as a researcher.
Yeah. Okay, so this is a rapid fire last question, just for all the panelists here. It's a cross-cutting sort of question.
Right, so if you could change one aspect of research ethics review to improve, whether it's equity, accountability, community benefit, what would it be? Why?
Rapid fire.
So for the research ethics board,
No, an aspect of research ethics.
for us,
In general, yeah.
okay. So to me is just ask one question. Are we doing research properly? Because the properly has two aspects: no harm done, at least. That's taken care of, to some extent by the ethics board's help. But are we inclusive? Are we justice-based? Are we fair? Are we, accommodating people's need and giving them benefits? So that's a thing probably will differ from person to person. But on the other hand, it's more of are we doing research properly so that everybody benefits or everybody grows together? Because by doing research, I'm growing. I became a researcher, postdoc to assistant professor, associate professor, and going on. One of the reasons we are continuing doing, because that's made me come here today. But if I am benefiting, if I am growing, I need to ensure that the research participants and all other involved in the research I have is growing as well. So that two components: are we doing research properly in terms of do no harm? That's taken care of to some extent, but the growth part, I think we fell short there, including me.
We need to do more work on decolonizing research ethics. And so we have an Indigenous people section where we ask you to tell us about, how you're working specifically with community, but we're still forcing Indigenous researchers to comply with a very Western and colonial framework for reviewing research ethics. And so there is work that's being done here and across the country and in other places, but we need to find alternate, parallel, and different, more community-based ways to review Indigenous research so that the process of getting ethics approval isn't harming the researchers or the community members who are participating in that.
Well, maybe, I think that it's important to do the knowledge mobilization, or like trying to, yeah, give in a more clear way the result of the research to the community. Because sometimes community feel that we are just going there, extracting information, and then we, we are not like giving back, the results of the research and the findings we have and the ways as we can like continue maintaining this relationship or continue doing research. So yeah, I think this is much. Thank you so much for.
Oh, very insightful.
Well, thank you all for your final comments and your final aspect of research that you would change. Wishing and hoping for all of that very soon.
So not only us, everybody.
Yes, whatever your wish is awesome. Thank you so much for joining our first CHS and Cheese and O'Brien Acre seminar. We hope that this conversation has sparked new ways to think about ethics in health research and something that you can carry on in your work and in the world. We want to give our sincerest thanks to our speakers for their time, for their insight, to the CHS faculty that made this possible, and to everyone else that attended today. Really, really appreciate you and this discussion, and please enjoy the rest of your week.